¿Qué te duele? Algo te duele. Yeah, I've never been to a doctor's States, Bill. Really? In Juarez? That's fine.
We were trying to leave. They just arrested me.
Everybody.
And we had nothing to do with it.
Put a copy of the agenda there.
Call to order this meeting of the County Hospital District. I'd like to start off with the invocation, please. How are you doing, Captain?
I'm good, thank you. Welcome all. My name's Doug. I'm staff chaplain here today. Ask you all to please keep Dr. Ard and wife Kelly and their family in your prayers. They continue to support some physical struggles in their life and also for the Joe Guerrero family. Saw the emails, a long time, 3+ years, 30. So, let's pray. Father, we love you and we appreciate you. We thank you for everything you do for us. Father, this is a new year. Excited, we're looking good here, Lord. Father, you tell us that your grace and your mercy is fresh and new and abounds every day. Father, we need that. And we thank you for it, Lord. Father, we're standing strong on our faith, dear Lord, giving you all glory and honor. Amen.
Amen.
Would you join me for the pledge of allegiance?
To the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. On the Texas flag, pledge allegiance to thee, Texas, state, and indivisible.
That messes me up.
You get, we'll let you get sober.
Yeah, so long we can't hear.
If somebody messes up, I'll go down and correct it.
I think I'm kind of staying calm.
You read our mission, vision, values.
Medical Center Health System is a community-based teaching organization dedicated to provide high-quality care to the health and wellness of all residents. Medical Center Health System is source care safety, integrity, customer service, accountability, and effectiveness.
Different.
We have sensible work. Not a good group of folks. Let me just start by saying, so we recognize some of our we all know that our best asset, how far, passing our motor, they are the ones. Be successful and grow out. And they are a bunch of prouder, more proud of what they do day in and day out. Honestly, the battle stood in the gap. Some people have family hope. As an example, we start first this
I still do.
Lindsay works endless hours to do whatever is needed. You are when you're short-handed. Every person. Help evacuate, share patients in the All right. Next one I have here is non-clinical. A lot of things we go off script here. She has been able to accomplish top of everything. I realize this lady time in our history. A lot of conversation. Love thickness, love size, and mask, and I can tell you that reason our this piece of paper has a lot of things on it. I want to do the most. Her work.
Thank you.
All right, now then, let's talk about the nurse of the month. That's Lisa. Lisa, are you here?
Talk about it once you stop.
Better be careful for me. From the beginning of COVID-19 pandemic until now, can't think of a single organization that's been more instrumental in the most. She has led her department by setting the level for all 7 days a night to ensure that every COVID taking every challenge that this pandemic has put on me. Outstanding job keeping this target. Lisa has calling, friendly, attitude, have a full house. She doesn't have here, but let's do one more round. All right, now let's move on into our the first big award I have here is time of year. This young man is being in cardio. Have integrity and very close. They know my first conversation. Untitled Chapter. Last name. Happy. I-19. Our time has been working. Ours is going to work each day and not issue any calls and calls that calls for the I can go, let's think about this. I think, biggest part of this, especially with traveling. All right. Now for the 2024 Nightingale Nursing Award. On again. Well, I've already said a lot of nice things about her earlier. Back to the year 2013. Well, and please join me in one more round. Listen, buddy. Thank you for being here. Finally, knock a lot out so we don't overload this room, but thank you for what y'all do. Thank you very much. Mr. Chairman?
Okay, next is the conflict of interest disclosure. If the board member has conflict of interest, I'll be vote. Next up will be public comments on agenda items. If anybody has any comments that they would like to make, have not already, give us your name, information, online. Anybody signed up for that? Go ahead and move past that. Onto the consent agenda. We've got things listed. Let's look that over.
A motion for approval.
Second.
I have a motion and a second for approval on the consent agenda. Favor say aye.
Aye.
Opposed, same. Committee reports, finance committee, Ms. Dean.
The finance committee met today prior to financial. Item on there, I know we had 4 capital.
I'll second.
Motion is for second. Favor say aye.
Aye.
Opposed, the same. Carries. Case management.
This evening, I would like to introduce Kim Lethwich, and she's going to go over our case management plan presentation. Her associate chief nurse officer over many departments as well as our utilization and our care coordination departments. I'd like her to come and kind of go over a plan. You guys give us the authority to make sure that we're doing right case practices, discharges, so I'd like for her to go over that with you today.
I can't.
I couldn't even join teams, darn it. All right, well, thank you for giving me a little bit of your time. I'm going to go over what we call the utilization review plan, and you might hear me also call it. On our DMV survey, it was discovered that we didn't have a formal plan in place. Lindsay Duncan, our 8-page plan here, and I'm only going to give you 5 little highlight points. So hopefully they will approve it the next time they come through, and so basically the purpose of it. Okay.
Well, listen, don't be nervous, you're also on,
Oh,
for the whole world's watching.
Yeah.
Oh, boy.
and if you were online, I couldn't see your face. I know.
That makes me feel sorry.
I try.
So basically, the purpose is to process how it's set regardless of pay. So that is the purpose of the point. 1, it outlines development of our inpatient observation. One of the really important parts they are kind of on us if we have like our patients ensure that medical also on admission. Also another every admission team diagnosis. All process.
I'll just go.
This is exactly. I'm really pathway. Thank you, man.
And I do need the approval of that case management plan, just so Sandy has a record. It was approved by the board of directors, and that you are granting, continued use of our utilization management on your behalf.
Motion.
Have a motion and a second, all in favor, say aye.
Aye.
Opposed, the same.
Thank you. So the second thing that I have for you, resolution, as you all currently know, our state designations are level 3. We are coming up to now the month of June. So with that, we need to update resolution that on state, basically on behalf of the board, you're going to and the staff, the physicians, the education, equipment purchase that may be needed. Just overall, the overutilization of our JRAC so that we can best practice. If I can get your have that for signature.
A motion for approval.
Second.
Second. Aye.
Aye.
Opposed, the same. Next up, Mr. Benelini. Never looked better, sir. Online. And press your mute button, sir.
I think we need to. Doctor?
Do you hear me?
Yeah, there we go. We got you.
Dr. Ventolini.
Hello. First of all, Happy New Year. I hope you have a joyful, healthy, prosperous, and blessed 2021. And I want to thank you, like always, very much for everything you do for our students, residents, faculty, and community in general. The medical students, they took a very long vacation. They will be back January 11th. The residents are working very hard, as you know. The students are doing their applications for the matching day, all through the Zoom. So at the end of this month, we have to send the list of the ones that we have to accept and the ones that they are going to be accepted themselves. It has been very hard. We have almost 4,200 applicants for internal medicine, more than 800 applicants for psychiatry and OBGYN, and we have close to 2,000 for family medicine. So the ones that they get choose are certainly the best of the best. Also, regarding the residents, some of them they have been accepted already to their fellowship programs. So this is the time that if you need a certain specialty that you are looking for, to try to reach them and entice them to stay, come back after they finish their fellowship program. The faculty are all doing well. Fortunately, nobody has get sick with the COVID except when they don't respect the rules and they go outside and they party. But nobody at work, thanks God, has been contagious with the COVID. we receive also 200 doses of the Moderna vaccine that has helped to vaccinate with the same priority that the CDC have. Our first responders and the people who are in charge of seeing patients, and then all the dinosaurs like myself, over 65, and it's very likely that we got a little bit more vaccine, and then we'll be able to also vaccinate the students that are going to be in the front taking care of patients. Plans for the future are to continue to grow. There's a possibility in the future to looks like restart a residency training program in surgery. Dr. Viney is very interested. Looks like there are some conversations with Dr. Viney and MCH and MMH. We'll see where do they go. And also there's a possibility in the future, a couple of years from now, to start actually a residency training program in aerospace medicine. So as you see, we make a lot of progress, and thank again for everything you do. And again, we hope that you have a blessed 2021.
Thank you very much, Dr. Bellini. It's good to hear from you. Okay, I guess we're done. Thank you. Thank you very much. Okay, Mr. Tiffin, your report, sir.
Just a few things to report, and I'll try to keep it moving right along. First of all, our Human Resources Quarterly Report. We do have 3 interviews set up for Thursday for our Human Resources Director spot. We received a bunch of applicants for that, some good ones, some more, and I'm proud to announce that all 3 of the candidates we are interviewing are all from the Odessa Midland area. So we feel like we'll start there and see if we can't find us a good one there. But we will be holding those interviews this Thursday, and they'll go through the peer interview process after that. I just want to update you real quickly on our inpatient rehab situation. You know, we made a move right before the holidays to ship our inpatient rehab folks to Compass Health, which is located right across the street from Sam's in Midland. And that opened up a big section of beds and space for us here at the hospital. The day that we moved those people out, how many did we end up moving that day? Were we down just a handful of patients? Did you remember? 5, maybe? 5 or 6. So the timing was good for us to move those out. Just to give you an idea, we had 59 employees in there. 38 of those were nurses, which we were able to move directly into the nursing floor. So we had 90-something nursing spots open, and we were able to move 38 of those straight into another spot and fill those immediately. We had 1 person retire. We had 4 that requested to be terminated, so they would move on. And then we ended up with 9 on a severance package through the 16th of this. So all in all, that was a very good move for us. The timing was, we got to the point where our patient load, our COVID load was as such. We wish that it could be a different month of the year. However, the situation just got to the point where it was time to do it. So we made that happen. We do have an agreement with the inpatient rehab that we'll talk about in executive session just a little bit. But overall, that's been a very smooth transaction for us with minimal collateral damage. So it's been very good move, and it's allowed for more floor space for patients here at the medical center. Our information technology quarterly report. Linda, do you want to do that right quick?
Sure. Wanted to give a quick update on some of the things that we've been doing, working on in IT. And I did get a little carried away with the slides, so I'm not gonna go through all of the slides. You have this information. But primarily for the past quarter, we've really been focusing on, some of the challenges and needs that the COVID-19 crisis has brought to us, as well as increasing our security measures to prevent our medical center from being the next victim in a cyber attack, as well as continuing to support our users with our end users, their systems, and projects at MCH. COVID-19, one of the things that's going on there, we've helped facilitate remote access for some of our workforce so that we could socially distance and get people out of their close confined cubicle spaces so that they can work a little safer. We've worked to get a lot of equipment out on the floors so that patients could communicate with their families if they can't come up and see them, as well as helping our clinicians be able to communicate and monitor those patients as well. We focused on telehealth initiatives. We have several of those going on. We're still working on a good solution for telehealth. We've got a few different vendors involved, and we want to try to consolidate some of that. We built out a lot of integration points with new lab equipment for some of the COVID testing that we needed to get in place so that it could feed into our EMR more quickly. We also stood up additional clinics and units, both physically and within our systems, as we were having to rapidly open units because we were running out of space to put those patients or needed to ship them to separate those patients from our not quite as sick patients. And we also built out the integration points for the new lab equipment. From the security perspective, we've been talking a lot about security, trying to get everyone a little more mindful of security on a day-to-day basis. It's something IT thinks about every single day, but not everybody thinks about it every single day. So we've been trying to bring that more to the forefront. We've been implementing a lot of new different tools, processes to try to keep us a little safer. An interesting tidbit for you guys is we block 37,000 pieces of phishing or scam or malintent or bad intent malware every single day for this facility with some of those tools. And we still have a lot of tools that we need to implement. We'll be talking about that a little bit later, probably next month. There's still room for improvement there, some additional things that we can do, but we are definitely continuing to focus on security.
What was that number again?
37,000
A day.
a day.
Wow.
Yes, sir. We are continuing from a support perspective. We're still field approximately 3,000 incident calls a month. That does not include projects that we have going on, alignment room projects that are about to get back into gear. So our team is still continuing to do that, as well as doing our rounding on devices and with our end users and with our leaders. We have 28 current projects actively going. We are continuing to set up new provider clinics as those come about, and recently we've been helping assist with the vaccine clinic that we just wrapped up today, and we'll kick off again in a couple of weeks. And we've also been assisting with preparations through the EMR builds and policies and procedures for the regulatory things that are coming in 2021. And lastly, just a little bit, because we really don't do that very often, we recently received the most wired recognition for certified level 7. We're one of 112 hospitals in the United States that received that recognition. And what that means is that we were able to show that through the adoption and the use and the integration of all of our technologies that we've been able to improve our patient health and their safety and the care that we provide for our community. So, our team, we've got a team that's been working hard on that. So, it's a few years that we got there. So, thank you.
37,000 blocks a day, that explains where my fantasy football. Of course, we saw how they ended. I'm glad that they did make it. Linda, thank you for what y'all do. You think about the amount of data that's being entered and passed on, and x-rays and CTs and ultrasounds and heart rates. I mean, just the amount of data we have streaming in and out here. Then you put at least one device in everybody's hand or their pocket with their cell phone and tablet. I mean, just the amount of the work your crew does. We thank you for that, because you only hear from me when something's not printing or I can't hear my computer or whatever it is. But thank you for what y'all do, and y'all do an outstanding job. That's a huge deal. Congratulations on that. Let me just talk briefly about COVID. About what we've accomplished here the last couple of days. Let's just talk about what our COVID looks like today. Today we have 68 COVID patients in the house. That number is much better than where we were just a few days ago. You remember we were sit back March 2nd when we had our first COVID meeting, coming up on a year. I remember when 68 used to be a big scary number. Now we're happy to be it. 11 of those are in CCU, 8 are across the street. We have 14 patients on the ventilator, 25 patients on 4C, 24 on 7C. This is interesting. Our list of where these patients are coming from include Andrews, Balmorhea, Blue Springs, Missouri, Crane, Fort Stockton, Kermit, Caney, Midland, Pecos, Presidio, Ruidoso, New Mexico, Sugar Land, Texas. So you may ask, how does somebody from Kansas City get here? That's probably somebody that was here visiting and came in through the emergency department. We're testing for COVID on OC students and athletes today on the OC campus. And so we have some of our OC friends here that will be visiting with us. We sure do appreciate our relationship with Odessa College. Total vaccines, this is a big one, have given as of today 2,611. And that was just really in a matter of days. And it was an amazing process. Kristen, what you pulled off down there, Linda, everybody that was involved in that, being compared to Chick-fil-A is a big deal. With sauce. And to have these people come in and, they're standing out by the parking garage and they think they're going to be here for 3 hours, and to see them come through the line and have a shot in under 30 minutes, flat out amazing. Our last 7 to 10 days with the holidays, knocking out what we did. Yesterday we did over 550. Today we did 213. Get our 2,500 doses, 611, because we got a little bit extra out the door. It was quite a feat. Get to tell the teachers, I said, to stand in line and not touch anybody like they tell those elementary. All day long was pretty fun, but the ECHD has 4,200 employees, and through this first round, we only got through 700 of them. You can see that you start looking at these big numbers. So we did order our second round for all those who had the first. We ordered the second, 2,500. Then we have put in a mass order, excuse me, somewhere between 25,000 and 30,000 for the next order. So whatever we did downstairs, we're going to have to multiply that by about 10 to be able to move those in a timely fashion. We are looking for partners to partner with us, and that includes the city, the Odessa Fire Department. We've already visited with them. We had some people from the county on today. We talked to, again, our friends at Odessa College. We'll have a kind of a citywide leader call tomorrow. But I think we've got something here that works pretty darn good and has been put together very meticulously to get it rolled out. We're not looking to reinvent the wheel here. We're just looking to start getting this out into our community on a global top level. But if you think in this Ector County, you're probably dealing with 150,000, 180,000 people that are going to be eligible for this shot. So biting off 30,000 was my idea, and I'll go down in flames with it, or I'll help celebrate when we roll those out. But we're to the point now where we know masks work to a point, social distancing work, but ultimately we got to get people inoculated to get this herd immunity going, so we can get past this thing. We are going to be the leader in it. That's kicking and screaming the whole way or sliding right through. But what we've been able to pull off here in the last week, especially around the holidays, has been nothing short of, in my opinion, amazing. When you see staff rolling these people through, they were given a shot about every 45 seconds, about every minute. somebody was getting a needle. And that's when people drawing it up, the people hold it in their pocket, or under their arm, defrosting it, or people entering, filling out cards, whatever it was. It was quite a scene just to roll that many people through. And this board should be very proud of those folks because they did an amazing job. And if you start looking at people around us who have doses, they still have them, and we can't figure that out why they don't move those. Our goal is to get them in here and then to get them out of here, and that's going to be our goal the second time around. But this time we're talking a big chunk of people. So I may call on y'all to come help us direct traffic or hand out water or whatever we need. But at the same time, we're looking to move this from a 2,500 number to a 25,000, 30,000 number. And my goal would be to be able to deploy those in a 1 week time. That's pretty lofty. At the same time, we don't want to sit on them. We want them out. Because guess what? You give 30,000 out, you got to give 30,000 again to give them their second dose. So it's not just one time through, it's twice for everybody. So now you're talking 500,000 shots you're going to be giving them all second.
Well, Russell, I know I got a call from a couple of people from ECHD, and they were all at y'all's efficiency, y'all's professionalism, and they just wanted us to let y'all know that y'all did a great thing. And I know, we want to thank our first responders, with every chance we get, but there's not enough words that can be said from the community. I know from my constituents that there's not enough to say about how wonderful y'all have been, all the way from the admin, all the way down to the people who are actually in the trenches. And like I said, this is a time in history that will hopefully never be repeated again. But y'all have taken it in and really been a standard that I know I wish people I would with would do the same thing.
It's an amazing thing when our phone calls are from doctors saying what an awesome job was done and how amazing it was.
When I start talking about 30s of thousands, I try not to let Kristen walk behind me. Push me down. But we just can't stand by and let things sit around and not get these out. I mean, our community trusts us. They search us out for healthcare, and we're the leader in this, and we want to get it out. And so y'all get ready for that. And we may be outside of the box, and we may be even a little out of bounds on what we do to get this deployed. But if you think each one of these boxes look like a pizza box, and each one of those holds 1,000 doses, if we want 25,000, we're going to have 25 boxes of those sitting in here. And we're going to move them, and we're going to move them pretty quickly and just as efficient as we can. But at the same time, it's not one group, it's not one person, but it is a unit working together to make sure that these people get through. And it was pretty awesome to watch. Just so you know, on the testing side, we've tested over 16,000 people through this whole thing. I mean, that's pretty interesting too. You remember, we've been out in the parking lots swabbing people in their cars, and that's probably what this mass inoculation will look like. Is don't get them out of the car. Pull up, roll up your sleeve, let us check you out, inject you, sit you in the parking lot for about 10 or 15 minutes, make sure you're okay, and then off you go. So it's going to be pretty interesting to watch that. And what I like about it the most is when people call me and say, hey, how did y'all roll out 600 shots in 4 hours yesterday? How did y'all do that? And well, here's Kristen's number. I said, I just look pretty and sign the payroll checks, and they make it happen. So
That's true.
I want to commend you again. I got a few phone calls over the holidays, one from Representative Landgraf, just speaking so highly of you and your team for allocating some of the vaccines for the outlying counties and the hospitals. And, he made a comment about, other hospitals not doing that locally, and just praised you and stuff. For all of y'all to do that, it's a thank you, because we're getting good feedback from them
That's-
too. We're taking care of them. We need to.
That sends all the right messages.
Yes.
Well, you know, I've been in those chairs in Fort Stockton and Andrews, and I know what it means for medical center to prop us up and for us to prop medical center up. And if somebody in Crane or Pecos or Kermit goes down, they're gonna turn to us to help prop them back up. So it only makes sense to get their frontline folks started down this road. So we're glad to be good partners. So, but that's a lot and more to come. So stay tuned on that. You know, we don't, although we like to say we get it right every time, we don't. But we know this, when we don't get it right, we learn from it and we make sure that we correct that and get it done better the next time. But on this deal, time is of the essence. We've got to keep stepping forward, keep moving, and I look forward to y'all getting more of those. Hey, they did a good job phone call today, because that's our plan, is to keep those moving.
So we have given out all the shots already? I mean, everything's gone?
Every one of them.
If this
So
shot, I can
people
get-
that are coming in for shots now, they're just told to wait?
Yeah, you know, what we're telling them is, stay in line with our Facebook, our Instagram, our Zoom calls, the newspaper. We're working with our media partners, and we told them, when we get big numbers in like this, we'll open this thing up, and just follow us and keep up with it. So, I mean, we were out there today, honestly counting 98, 99, 200, 201, and we had a stop point. And we moved those people through, and we told a few to hang around, let's see if we had, and sure enough, we had about 13 or 14 more we could squeeze out of them, so we were able to work them in. But it's amazing, you walked out this morning, the line was all the way past the parking garage. They tried to get down to Golder down here. We had to corral them all back around, but so far they've been very patient. Nobody's been too impatient, but they thought they were going to be in line for 3 or 4 hours. And we moved them through the whole process in less than 30 minutes. So that was pretty awesome. All right, any other questions or comments about that? All right, not leaving anything out. I think I've got it all covered, unless we talked about the testing. We got that done. Oh, let me just follow up real quick on our employee that passed away, Joe. 32 years at medical center, a lifetime here. And unfortunately, got sick and he passed away. And we will be honoring him, and we will let you know what the family decides to do with the service and that. But please keep Joe and his family and our family here. They're hurting too down there in radiology. That just pray for them and keep them in your prayers, because 32 years with a coworker, you spend more time with your coworker than you do with your family, and they are family. And so our family has had a tragic loss here. So please keep them in your thoughts and prayers. I would be also remiss if I didn't mention that, you know, oil was over $50 a barrel today, and we will come out of this, and we will be better on the other side. What you said in our finance committee meeting, when you look at those days cash on hand, that bar was that big this time last year, and now it's this big, with more in there. That we are weathering the storm one day at a time, one case at a time, and one patient at a time. And ultimately, I think we'll be much stronger when we come out on the backside. If there's no questions, I'll save the rest of my comments for executive session.
Just one for me, do we know when we're gonna get the next vaccine?
Anybody want to step out on that slippery ledge?
No, we don't. They haven't allowed us into the system yet to put in a request.
Okay.
We were only allowed to put in a request to replace the 2,500 with the second shot. So we'll try, Amanda logs in a few times every day to see if we can put in orders.
Okay. All right, thank you. All right, well then we'll go into executive session. Meeting held in closed session involving any of the following: consultation with attorney regarding legal matters and legal issues pursuant to section 551.071 of the Texas Government Code, deliberations regarding real property pursuant to section 551.072 of the Texas Government Code, and deliberation regarding notification for healthcare services pursuant to section 551.085 of the Texas Government Code.